Yay! We just finished a hair restoration procedure. You're probably thinking, now what? You're probably not in the mood to read our 5 pages of take-home instructions, so we decided to create this little video to explain to you exactly what to do and when to do it. It's very important to follow every single instruction to a T to make sure you don't mess up any of the hard work Dr. Max just spent putting in every single graph meticulously.
You just finished your surgery. Let's review the medications that were prescribed. First medication is doxycycline. Doxycycline is an antibiotic that needs to be taken before and after surgery. You will continue taking until you run out of your 5 pills twice a day. The next medication to be taken is prednisone. Prednisone is given to you to prevent swelling. You will start taking this medication tomorrow morning, 2 pills, which constitute 40 milligrams for 3 days. In case there is no swelling occur in your forehead area or the back of your head, then you can stop taking the medication. In case there's a slight swelling, please contact us and we'll direct you whether we need to continue taking medication for the full 5 days.
Please wear the shower cap for 1 day after your procedure. Keep it off for 20 minutes every 4 hours. Please take it off at night. Keep the surgical tape on your forehead for 5 days to minimize the swelling. Be a good patient.
Pain medication is also provided to you. Typically it is Tylenol with codeine. You only take it when you have discomfort. Most of the time our patients recover very easily without the need of taking the medication. Otherwise, just follow instructions. You can take it every 6 hours as needed. Ketoconazole is the medication that is prescribed in the form of shampoo. Ketoconazole 2% helps you reduce the inflammation after surgery and is used as a medicated shampoo. We do recommend to apply it twice a week, let's say on Tuesday and Friday, and to leave it for 5 minutes so the shampoo can exert its therapeutic action. And you start using the shampoo day 30 after the procedure. Minoxidil is the next medication.
For men, starting 2 days after procedure, take half a tablet for 2 days. Increase to a full tablet for the next 17 days.
For you ladies, on a day 2, start a half a tablet daily for 20 days.
It is important to monitor your blood pressure while taking minoxidil.
And report it if it's lower than 110 by 70.
Typically, it is well tolerated and we never had anyone not being able to continue taking minoxidil.
Dr. Max's Hair Boost is a topical solution made with clinically proven ingredients to prevent hair loss. This is to be started after finishing your oral minoxidil. What you're going to want to do is take a quarter of the dropper and apply it to the scalp. Leave it on for about 8 hours. Most patients tend to do this in the morning after shower with the hair already dry or before bed. This bottle is available for purchase in our clinic and should last you 3 months.
No aspirin, no alcohol, no coffee. Be a good patient.
No vitamin E,
No fish oil.
no cigarettes.
Be a good patient.
A thin coat of triple antibiotic should be applied to the donor area twice a day for 7 days after your procedure. Please put it only on your donor area. Slight bleeding or oozing may occur from the donor area. We recommend putting a towel on your pillow for the first couple of nights to prevent the pillow from getting stained. If you see bleeding, please take a clean cloth and apply a firm pressure to your donor area for 10-15 minutes. If the bleeding does not stop after 15 minutes, please contact our office.
So this was a surgical procedure, and as normal with any type of surgical procedure, swelling can happen. We do have some tips to help with the swelling process. Tip number 1 is attending as many hyperbaric sessions as possible. Hyperbaric sessions can greatly reduce the swelling and inflammation and help you heal faster. Tip number 2 is sleeping in a reclined position for 3 days using a travel neck pillow. Tip number 3 to help with the swelling. We recommend applying ice to the forehead and the temple area every 2 hours for 20 minutes. Be sure to avoid the grafted area and make sure the ice pack is wrapped in a clean cloth. If after 3 days swelling still persists, switch to a warm compress and apply to the forehead and to the temples. You can also consider coming back to our clinic for more hyperbaric sessions, as that is the best way to help with swellings.
Let's talk about exercise. Light exercise is exactly what I'm doing right now. I'm just walking light, okay? So, after surgery, you want to avoid strenuous exercise for at least 7 days. Strenuous exercise can elevate your heart rate about 100 and steal the blood supply to your muscles and to your heart, and you want to avoid it and provide as much blood flow to the recipient area instead. So, after having surgery, you want to at least avoid gym and heavy lifting for at least 10 days. When you're moving around, it's important to be aware of your surrounding. If I'm trying to lift something off the floor and hit my head in the wall, it can damage your grafts. So you want to be well aware what you're doing, how you move, so no physical impact can happen to the recipient area. Same situation when you're trying to enter the car. Entering the car after surgery is another situation that potentially can lead to damage to the recipient area. You have to be very careful when you do it, especially after surgery where you do not feel the top of your head for some time. So the way it should be done, place my hand on the door frame so I can see and feel where it is. And then I enter the car, avoiding impact with the door frame. Same thing when I exit the car. So for me to exit the car, I need to put my hand on the door frame and slowly exit. Let's talk about swimming. Swimming should be generally avoided in the pool for at least 2 weeks. It is important because pool water frequently contains chlorine, and chlorine is toxic, especially for the newly transplanted grafts. Swimming in the ocean can start after 1 week following the surgery. Light swimming is probably what you should do. Definitely no participating in Ironman competition.
No showering for 5 days.
To wash the grafter area at day 5, you're gonna create a soaping solution with the baby shampoo. You're gonna grab a bowl with water and you're gonna gently put the solution on the grafter area. To remove the soap, you're gonna grab another cup with clean water and you're gonna just remove the soaping solution from the grafter area.
You're gonna wash your grafted area and the donor area by using a small amount of shampoo. You're gonna do a small massage in the donor area, enough to remove the ointment. In this case, it's gonna be the antibiotic ointment. And then you're gonna use a small cup to wash it or rinse it out.
On day 7, you can finally wash your hair underneath the shower in a normal fashion. Apply the conditioner directly to your scalp and leave in place for about 15 minutes. This will help the scabs finally starting to loosen so they eventually fall off. On day 7, you can also discontinue using the ointment in your donor area.
You can use 2 to 3 spray to the grafter area. This is gonna help with the itchiness, with the healing process, and it's gonna keep the graft moist.
After surgery, it is commonly to see crust and scabs occur in the recipient area. It is normal, and what it represents is the epidermal part of the graft. It takes between 2 to 3 weeks for scabs and crusts to clear naturally. Sometimes it happens a little bit sooner, sometimes it takes a little bit longer. It is important not to remove crusts or scabs forcefully because it can accidentally pull the entire graft out. You can use a shampoo and conditioner after 2 weeks to soften them and help to facilitate the natural removal.
Style your hair is desired, and remember, use a blow dryer on a cold setting. If you need to dye your hair, just wait 5-6 weeks after surgery, and do not use styling products which contain alcohol.
After 20 days and finishing oral minoxidil, it is safe to resume using topical solution. We do recommend using finasteride with minoxidil topical solution that could be also provided from hair by Dr.Max Restoration Center. Sometimes irritation can happen after using minoxidil with finasteride. Please report any discomfort to us, and we can determine what's the best course of action at this point. Most of the time, no serious inflammatory reaction happens as a result of using the finasteride and minoxidil solution.
Hats and hairpieces should be worn only if necessary. Please, if you're wearing a hat, make sure that it's not too tight to not damage the crowds. If you'll be on the sunlight for more than 10 minutes, please make sure to wear a hat for 3 months after the procedure. You may start wearing an SPF 30 or higher 7 days after the procedure. Please avoid tanning for 3 months after the procedure.
Fine nerve endings may be affected during each procedure. This will result in decreased sensitivity or numbness in both the recipient and donor area. This usually subsides in a period of 3 to 6 months, but may last for longer periods of time.
Your first visit after the procedure will be the following day or the following Monday. During this appointment, we will remove your dressing and apply ointment and take pictures and make sure you're healing properly. We also strongly recommend doing the hyperbaric session during these appointments and the next couple days if your schedule allows. So, you just had a hair transplant. You're probably thinking, now what?
What do you mean? Wait.
For men, take half a tablet daily for 3.
Ladies, take it.
To watch your hair.
I lost my train of thought.
And then increase that to, I'm gonna do that one more time.
That should be proceed. Okay.
I don't think I did.
It can damage your grafts.
Stop.
Increase to a whole tablet, was it? Whole tablet?
Entering the car.
Okay.
Increase to 1 tablet?
The car. I need to put my hand.
I just didn't know if it was a full tablet or what for the next 17 days.
So no physical impact can happen.
I'm gonna do that one more time.
If I'm trying to lift something off the floor and
1 tablet, okay. Increase to a whole tablet, was it? Can I say restore? Increase to 1 tablet?
Be good patient. Yeah.
So it's 2 and 2, okay. Take half a tablet.
Okay.
Did I say that correctly? No, I didn't.
We don't have the solution, but we can have the issue.
Oh my god, dude.
Then you're gonna grab clean water.
For men, take half a tablet.
Whoa, both.
That's so weird, bro. That's weird. Sorry, one more time. My bad.
I know.
That's fine. Oh wait, my god, wait. Especially compounded. Okay. Especially compounded.
Можно, like...
I know. I think the first one will be better.
Alright.
Vamos para atrás porque tú sabes, te voy a poner al lado de la camarita.
I'm sorry.
You're good. Alright.
Herpes, no, wait.
Topical compounded. Specially compounded hair solution. Made with clinically proven ingredients. Is Restore okay?
Just hold on.
Proper topically to the scalp. Clinically. Yeah.
Короче,
That's weird.
Heads and hair pieces.
Apply a quarter of the dropper.
And always remember, do not use
And promote hair growth.
So now it's your part to make sure you're doing exactly what you need to do so you don't mess up.